The shutdown of New Mexico's behavioral health providers and transfer of their management to Arizona firms was done without due process or evidence of wrongdoing.
15 behavioral health providers had been suspended from the Medicaid program because they had been found through a special audit to be guilty of fraud.
Optum had initiated supposedly a new software system that would develop and review anomalies in payments. Now, we had been informed that they were developing that system, but no one was worried because our assumption is that Optum, who called us partners, would come and talk with us about what the anomalies were. Well, apparently what they did then is turn them over to HSD. HSD then in turn contracted with PCG, the public consulting group.
A group, incidentally, which has become notorious around the country for their lethal audits. They never find anything but fraud when they do an audit.
And subsequent to that audit, called us all in on June 24th, told us that they were holding our Medicaid money and that there would be 3 decisions that they would make. They would either provide technical assistance, they would provide a management team, or they would do what they call a transition, which in my words is a hostile takeover.
They presented us with the report of the audit and basically said that because the failure rate was so egregious, they had turned us all in to the Attorney General's office for criminal investigation of fraud.
They kept the programs going through thick and thin for 40 years, and now they've suddenly been ruled to be not just unable to participate in the program, but guilty of fraud. Their reputations are ruined.
We asked the question, well, are we going to see the results of the audit? The general counsel said to the group, absolutely not, because it was such an egregious failure rate. We are canceling those meetings and we will not be reviewing any of the results with any of you because it is now under criminal investigation.
The fact that this audit is not being released to the people in New Mexico is very troubling. What's also troubling is the fact that the governor hired this Boston firm to do this audit when we have a state auditor.
Now we find out that the real start was back in the fall, back sometime before December of last year, when Arizona companies were approached by the state to see what would it take for you to come into New Mexico and take over the operation of our behavioral health providers.
The Affordable Care Act allows states to do this, but it doesn't mandate it in its totality. It allows the providers to appeal the process, so to speak, or for the state and the provider to come up with a reasonable solution. That's what this administration has chosen not to do. In fact, this administration has chosen to hide the facts from the people of New Mexico and to essentially dismantle these 15 nonprofit organizations.
Their reputations have been ruined. Some of them won't be in existence. They will not be able to participate. And I think that's what it's all about. I think that what the Secretary of the Human Services Department has set out to do, and has so far succeeded, is making sure that the network of providers, community-based providers that have been developed in our state over the last 40 years, that would no longer be even a viable option.
Now, what's lost in doing that is the cultural benefit of having long-standing agencies that have been in their communities, have developed their programs based on the needs of those communities, developed relationships in those communities, and developed an aura of trust in those communities. That is now lost.
For you to be successful in engaging people in treatment, you have to be culturally competent. You have to be able to appreciate the environment in which people live, and the communities are not welcoming to outsiders. And so you have to develop trust.
I feel that we're not even in the United States. I've never heard of a process where a company can come in, remove the executive director and our chief financial officers, totally do a hostile takeover of our agency without any due process whatsoever. And that's what happened. That's like what's happens in third world countries. That doesn't happen in the United States of America, but it has happened here.
Tell me this, you know, you're in a therapeutic relationship, you're 14 years old, you have, say, physical abuse in your family, you have a drug problem, and you're finally have built up trust with a certain therapist. Suddenly that therapist is gone. They're gone. They're being replaced by people, who knows who these people are, they're from Arizona, whatever. And the notion that our governor would say that there is no disruption in behavioral health services, that everything's going to flow smoothly, is nonsense.
But it's hurting the clients the way this is done. So it appears that because there's indications of overbilling or fraud in particular agencies, the governor used this and essentially bum rushed the entire behavioral health infrastructure of the state and decides to take it over and give it to this Arizona firm.
To see this occur without due process, just to wake up one day and to see the behavioral health system in New Mexico totally dismantled, even though it was not a perfect system. Not only is it heartbreaking, it's devastating. It's really devastating to all of us.
New Mexico's behavioral health providers have been hijacked and deprived of due process by the state. We must protect our other healthcare agencies and demand strong legislation to ensure this tragedy never, ever happens again.